If any of you parents have seen this rash, you know how frustrating it is and how difficult it is to get rid of. So I'm Dr. Tracy Tyson. I'm a board certified general pediatrician, and this rash is Molluscum Contagiosum. This is a viral rash. It's a little bit like a wart or a pox that is really common in children from the ages of 1 to 9. So it is a really, really difficult thing to get rid of, and they can spread really quickly, and it's really, really a pain. So let's talk a little bit about what it is, who's most at risk for it, is there anything you can do about it, and is this something to worry about? First of all, it is spread by a virus, and it is usually more common in younger children because your immune system usually will fight this one off. So how I first learned about this disease was actually in medical school, and we were trained that it was mostly just people with HIV because their immune system needed to be immune compromised or down in order for the virus to take hold and cause those little pox. However, children under the age of 9 don't have a full set of immunity yet, and so they are more likely to let this virus grow a little bit and create those little pox. So there's these little pearl colored papules. They're about the skin, and they're like a little pearl, and they have a little central dimple in them. They can be itchy, and they can spread everywhere. So things that can put your child at risk for them would be obviously the younger age, eczema, or like an impaired skin barrier. So anytime the barrier is open, obviously any virus can get down in there. And then also the use of topical steroids, mostly because obviously if the skin is irritated, the topical steroids are being used because of that, and it can thin the skin a little bit, make it more likely to have molluscum. Swimming pools is the most common ways that these get shared between children because they're all in one area together. They share the same surfaces. More of their skin is exposed when they're swimming. So that's actually the number one risk factor for getting molluscum is swimming pools, and then you yourself having the risk factor of having eczema. So first parents start to notice this in little areas in the elbows, wherever eczema typically happens. They'll get a few at a time. The problem with them is it can take the child anywhere from 6 months to 2 years to fight this off. And so it lasts forever. And the treatments are almost worse than the actual rash because they're painful and irritating. They can cause scarring. And we know it's really self-limited. It doesn't hurt anyone. It doesn't cause any complications. And so sometimes the risk of treatment is worse than the risk of just letting it go and riding out on its own. Some reasons to treat would be if it was near the eyes, if it was spreading really rapidly, if it was in sensitive areas, if it was really bothering the child and rubbing on a regular basis, there are some instances to treat. The treatments are not great. They're mostly done by dermatologists because of the fact that they are more highly specialized and they're a lot more difficult treatments. The only thing that you can do at home is to prevent the spread. So keeping the skin barrier as healthy as you can, making sure everything is hydrated, avoid topical steroids right on the molluscum, but making sure that you're keeping eczema flare down. Rinse your children off before and after the swimming pool can also be something that is helpful. If you have one child at home with it, try not to let them take a bath together if possible. I know that's hard. And then don't let them share the same towel. So another thing to add is when these start to go away, the body recognizes it as foreign and says, I don't like this. It starts to send white blood cells to it, and they kind of look like they're infected when they're going away because the white blood cells can create pus and redness. Most of the time they are not infected, and so leaving them alone is the best option. If you're confused and you're not sure if it's an infection versus it's just going away, please reach out to your provider and we can help you be able to tell the difference. So again, it's a really frustrating condition, but it is self-limited. It is not dangerous. It's nothing to be ashamed of. There's nothing you did wrong. Both of my kids had it. And it is more common in eczema, shared by swimming pools. There are some treatments, but they're not great. And the best thing to do if you can is to let it go on its own. Try to prevent the spread by keeping the itch down as well as the skin barrier intact. And follow up with your pediatrician or primary care provider if it's near the eyes or sensitive areas or it's spreading rapidly. I hope this helps a little bit. Take care.